Hello everybody, I am Dr. Nikhil Arbatti, consultant spine surgeon and endoscopic and minimal invasive spine surgery specialist. I have my own clinic in Vileparle West, Mumbai, the Advanced SpineCare clinic located at Dadabhairoad, opposite Gokhlibai School in Vileparle West. I am also attached to multiple hospitals like Nanavati Multispeciality Hospital, Bhatia Hospital, SL Raheja Hospital and Wokhats Mira Road Hospital. I specialize in spinal conditions and I perform all the spinal surgeries from the cervical to the lumbar spine. Today I am going to talk about lumbar disc prolapse or slip disc as we commonly know it. Now what is exactly a slip disc and how does it affect people? People have a lot of questions and a lot of doubts about slip disc. A normal layman person who comes, he feels that anything related to the low back, any pain in the low back is usually something related to the spine and it is something of a disc. The MRI report also, if they read and if they find that there is a bulging of the disc, they are afraid and they feel that there is a slip disc. So to clear your doubts and to give you some answers about what exactly a slip disc is and how it affects you and when is it actually a serious problem, this is my educational video. So if we see a spine model, basically it is made up of a vertebra, that is the bone. We have the disc below the vertebra and the vertebra again. So between every two vertebra is a disc, and behind the disc we see the nerves which are coming out. The nerves are coming out from the spinal cord. The spinal cord basically starts from the brain and it goes down up to the tailbone. So that is how the entire spinal cord starts and goes. So at every level behind the disc are the nerves coming out. There is one nerve which is coming out which goes to the left hand side, the left part of the body, and the one nerve which goes to the right part of the body. At every level the nerve which goes out goes to different part of the muscles and different body parts. Now if we see the disc from top, we see an outer covering of the disc which is usually hard and the inner jelly which is a soft. The function of the disc is to act like a shock absorber between the two bones. Whenever the body moves forward, backward, or does any movement of standing and walking, this disc and the shock absorber supports the two bones and prevents it from the bone from slipping forward and allows a flexibility in the body. This is the main function of the disc. Now what happens when you get a slip disc or there is a bulging disc and you are diagnosed with it? You get a condition something like this. Now if you see here, we have the disc, the jelly, which is very well concentrated between the outer borders. But if you get a slip disc, the disc, the jelly comes out. It comes out through the break in the outer layer, and this then goes and presses on the nerve, either on the right side nerve or the left side nerve. At the disc which comes out appears like this. Now the disc can come out at any level, either in the neck, in the mid back, the lower back, or in the near the tailbone. Now whichever level the disc comes out, and if it comes out and presses on the nerve, it causes an inflammation of the nerve by release of some chemicals. These chemicals which are released cause the inflammation of the nerve, and the level where the nerve is getting pinched, that nerve goes from the spine up to the particular muscle. That entire area then starts paining. And this is what we call, people sometimes say when it starts from the back and goes to the leg, as sciatica pain. So sciatica pain basically is, in scientific terms, the pressure of the disc over the nerve starting from the spinal cord, going from the back to the hip and up to the leg. So whichever area the nerve is pressed, that nerve gets inflamed. Usually if the slip disc is not very severe and there is only intermittent pain or intermittent tingling, medications, rest and little bit of lifestyle modification where the person is not bending forward give a very good relief of the pain, and the person gets complete pain relief. If the person presents with symptoms of severe pain, is unable to lift up the leg, the pain and the numbness and the heaviness is continuous, in those conditions the disc may be pressing on the nerve very severely, or it may be a big quantity of disc and the inflammation is very severe. In such conditions, medications, rest or lifestyle change may not give a complete pain relief or may not give it for a long term. In such conditions, it may be required either to give an injection around the nerve so that the inflammation is reduced, or we do a minimal invasive endoscopic surgery to remove this portion of the disc so that the nerve becomes free. I hope this has solved some of your queries. If you have any further doubts, you can contact me on my email, or you can go to our website www.advancedspinecare.in, or can contact us on our mobile number given below. Thank you.